Hello, this is Group 4, Sierra, Jordy, Caitlin, and Catherine. We will be presenting on white muscle disease in sheep. This disease is also known as WMD.
Hi, I'm Caitlin. I will be presenting cause. White muscle disease is a degenerate muscle disease related to a deficiency in selenium or vitamin E. It usually shows up in the first 3 months of an animal's life. When a lamb is deficient, it loses up to 50% of their vitamin E intake within a month. They can die within days of contracting white muscle disease. It affects the skeletal muscles, causing fatigue and/or paralysis. It typically is not transmittable to humans because it is a mineral deficiency, not a virus or a bacterial infection. Occurrence: sheep that are on grazing lands are more likely to contract white muscle disease because it is commonly found in grazing lands that are irrigated. It occurs in soils that have less than 0.5 milligrams of selenium. All breeds of sheep can contract white muscle disease. It is not specific to one breed, and goats are capable of contracting it as well. Once the animal's cardiac and skeletal muscles are affected, the chances of mortality increase to 70%. To avoid having lambs with white muscle disease, you should be vaccinated with selenium approximately 4 weeks before giving birth. Ewes that have not been vaccinated before giving birth have a higher rate of lambs being born with selenium and vitamin E deficiencies and contract white muscle disease, which increases the mortality rate. You can prevent white muscle disease by buying supplements with quality minerals. This is also enough to keep a healthy diet and to avoid white muscle disease.
My name is Jordy, and I'll be presenting transmission and clinical signs. White muscle disease can cause a great profit loss for producers, but does not have an effect towards public health due to the fact that the disease involves mainly towards nutrient deficiency. Therefore, the disease is non-transmissible as it may be present at birth in the early weeks of newborn lambs based on the parent's diet, and can later arise in older lambs if not fed the required nutrients of selenium and vitamin E. White muscle disease causes progressive paralysis that affects both skeletal and cardiac muscles. The skeletal muscles affect the arc of the back roughly around the hind legs, unable to move properly, and the forelegs of the lambs are spread excessively, which causes pain and stiffness when in a stand-up position. An increase in both heart rate and respiratory rate becomes irregular, affecting such that the lambs can die suddenly from heart failure. The diaphragm and esophagus are affected, leading the lambs to have difficulty breathing. Slowly progressive cardiac failure results in passive lung anemia, which causes a slow death due to suffocation. But don't get it confused with pneumonia, which has similar signs. To differ the two, anemia is a medical condition and pneumonia is inflammation.
Hi, my name is Sierra, and I will be discussing diagnosing and treatment of white muscle disease. When diagnosing this disease, a veterinarian will look at several key factors. These include if the animal has a hunched back, if the animal is resistant to any movement, if the animal is producing brown urine. If this animal is deceased, a veterinarian will cut into the muscles of the animal and look for a few things. The muscles will appear a very pale color, and the texture of the muscles will be very dry. When an animal is alive, a veterinarian can also draw blood from the animal and test for any nutritional deficiencies. This is helpful if you're trying to do a treatment and you want to know if you're going to be providing a vitamin E supplement or if you're going to be providing a selenium supplement.
This video, as you can see, is a goat who is currently experiencing symptoms of white muscle disease. While this is not a sheep, these species experience the same symptoms of this disease. This animal is displaying the hunched back, which is caused from the deficiencies in selenium and vitamin E. You can see that the hind legs are having issues with movement. Even when the owners are putting pressure on the hind end to force the animal to move, the animal is resistant to movement.
For treatment, these can include the following. They can include an injection of selenium or vitamin E. The animal can also receive an oral bolus containing selenium or vitamin E. If this disease has caused damage to the cardiac muscles, there is little chance to recover from this damage. If the disease has only reached the skeletal muscles, then animals can respond to treatment as soon as 24 hours. If the animal doesn't respond within 24 hours, then a second dose of treatment can be given.
My name's Catherine, and I will be discussing the prevention of white mussel disease. White mussel disease is not only a difficult disease for animals to endure, but also causes great loss of profit for producers. Both these reasons make prevention important. Prevention of white mussel disease with selenium deficiency in mind is usually done by giving pregnant ewes a vaccine combined with selenium around 4 to 6 weeks before lambing. Prevention can also be done by adding fertilizer containing selenium to the pastures that animals are grazing on. Lastly, providing selenium-rich feed pellets at weaning can also prevent white mussel disease. It is advised to be careful giving selenium to your sheep, as too much selenium can be dangerous and even cause death. Preventing vitamin E deficiencies can help to prevent white mussel disease as well. One way to do this is by providing feed rich in vitamin E. Ewes feeding on high levels of alfalfa are more likely to have lambs that suffer from white mussel disease. This means feeding your sheep high levels of alfalfa should be avoided to prevent a vitamin E deficiency. Oral drenches 6 to 8 weeks after pasture sustenance, followed by drenches every 8 weeks until green feed is becoming available, will help to prevent white mussel disease as well. There are plenty of reasons to actively be preventing white mussel disease in your sheep. Paralysis, passive lung anemia, cardiac failure, and slow death from suffocation is not something you want any of your animals to go through, as this is something that causes pain in the animals and great losses for producers. Luckily, white mussel disease is not a zoonotic or spreadable disease, but it can still be prevalent in your sheep. The good thing is there's many ways to prevent white mussel disease with selenium, vitamin E, and good practices. Your sheep can stay healthy and your job as a producer can continue.